From today, this lecture we are going to start the lectures on the surgery, and we will start with our topic from the general surgery, that is the shock. The shock. First of all, you see the definition of the shock. What do you mean by the shock? You will get the various type of definition. Different books are there, but correct and complete definition is this one. So what is it? The shock. It is life-threatening situation due to collapse of peripheral circulation, which leads into impaired metabolism. Impaired metabolism may turns into serious pathophysiological changes, even death. This is called as the shock. So life-threatening situation is what? It's a situation which threat the life. Anything happen from there. The patient may die or end the life, or the patient recover. So that's actually life-threatening situation. More chances of the end of the life, ending the life, threatening. So that's about the threatening situation. And why this situation occurs? Whatever the reason is there, but main mechanism is a collapse of peripheral circulation, and that will be leads into impaired metabolism. And if metabolism impaired and we continue, that may turns into the serious pathological changes. And if serious pathological changes are gross, it may cause the death also. And this condition is called the shock. So you understood? I will repeat again the definition of the shock. It is life-threatening situation due to collapse of peripheral circulation, which leads into impaired metabolism, may turns into serious pathophysiological changes or even death. It's called as the shock. Now you see the classification of the shock. Classification of shock. Basically, shock is classified mainly in two types. The primary shock, number one, primary shock, and number two, secondary shock. First of all, you see what was the primary shock and then the secondary shock. The primary shock means what? This is the type of the shock which occurs without any predisposing or pre-existing abnormal condition or the disease. Such type of the shock are called as a primary shock. Do I understood? The primary shock is this type of the shock which occurs without having any pre-existing abnormal condition in the body of the subject. It's called a primary shock. Means pre-existing condition that is leading to the collapse of peripheral circulation. It is not existed prior to getting the shock. It occurs suddenly and patient undergoes the shock. It's called primary shock. Secondary shock, it is the type of the shock in which there is a pre-existing abnormal condition which causing collapse of peripheral circulation and then leads into life-threatening situation. Such type of the shock are called as a secondary shock. Now these are further classified into different types according to etiopathogenesis. That is called the etiological classification, where the primary shock is classified in the following types are there. That is number one, vasovagal shock. Second, the psychogenic shock. And third one is neurogenic shock. Neurogenic shock. These are three types of the primary shock. Then we see the types of secondary shock. On the basis of the etiopathogenesis, the secondary shock is having the following types are there. Number one, hypovolemic shock. Hypovolemic shock. Second, cardiogenic shock. Third, traumatic shock. Traumatic shock. Next one is burn shock. Fifth one is septic shock. And the sixth one is anaphylactic shock. Anaphylactic shock. So this is a classification of the shock. The shock has been primarily classified on the what basis? On the basis of the occurrence, primary shock and the secondary shock. Primary shock on the basis of the etiological classification. This is classified into three types. There are three types of the primary shock are there, and there are 6 types of the secondary shock. First of all, we will see the primary shocks are there. In primary shock, the first one is a vasovagal shock. Vasovagal shock means what? The first one, it is a primary shock, or it is type of the primary shock, because it occurs from the stimulation of the vagus nerve. The vasovagal shock occurs due to the stimulation of the vagal nerve or vagus nerve. What is pathogenesis? Due to stimulation of the vagus nerve being a parasympathetic, and when stimulation of this nerve, it causes the vasodilatation of the peripheral vessels. Vasodilatation of peripheral vessels. When there is a vasodilatation of peripheral vessel occurs, the more blood will be pulled into the peripheral circulation or in vessels due to increased diameter of the vessels, because there is a vasodilation causing the increased diameter due to stimulation of the vagus nerve, and the more blood is pulled into the peripheral circulation. That will be leads into decrease the venous return to the heart, and this decreased venous return to the heart, it will causes decreased cardiac output. If this decreased cardiac output, it will leads into collapse of peripheral circulation and will cause the shock. They understood? This shock is a vasovagal shock. In vasovagal shock, what will the treatment then? The treatment, first of all, the patient should be kept in a head-low position or should be kept in the dental chair to maintain the blood supply of the brain, preventing the hypoxia of the brain. You have to do the head-low position. Second, the vasoconstrictor should be given. Vasoconstrictor should be given. What happens if the vasoconstrictor is given? It will cause the constriction of the peripheral vessels, and as there is a constriction of peripheral vessel, it reduces the diameter of the peripheral vessels, will causing increased venous return to the heart. And as this increased venous return to the heart means the venous blood return to the heart, it will causes the increased cardiac output, and as soon as the cardiac output is increased, there is a increased peripheral circulation, which was collapse, and there is a recovery from the shock. So this is the vasovagal shock. They understood? The next one is psychogenic shock. The psychogenic shock, it is another type of the primary shock. It is type of the primary shock which occurs from the disturbances at the psychic level. That's why its generation is where? Into the mental level, on the mental level. So that's why it's called the psychogenic shock, which occurs from fear, fright, overjoy, grief, sadness. This shock also occurs from the pain, severe pain. For example, the blow on the testicles will cause severe pain, and due to that patient may die. From fear, fright, anxiety, grief, from grip, the person undergoes the what? Imbalance of the circulation, causing the collapse of peripheral circulation, and that will lead into the shock. Such a shock are called as a psychogenic shock. We will see that in a movies or somewhere in truly also there. If some people listen the bad news like how death of the son, death of the mother, death of the nearer to whom they are loving, and if they listen this bad news, they are suddenly gets collapse. That shock is a psychogenic shock. Psychogenic, without having a problem in the heart. Heart is normal. Everything is normal. There is no pathological change. Any organs are there, but still listening such news, seeing such things that which can cause the grief, fear. You will see many of times person may be what becomes unconscious or undergoes the shock when see the lion suddenly in front of them. So this is called a psychogenic shock. Then next one is a neurogenic shock. The neurogenic shock, it is the type of the primary shock. Getting this shock also, the patient is absolutely normal. So that's why it's also the type of the primary shock. Now what is this type of the shock? The cause of the neurogenic shock is it occurs due to injury to the sympathetic nerves. Injury to the sympathetic nerves. For example, the spinal injury, trauma to the spine, which causes injury to the sympathetic nerve. Now why does it occur due to the injury to the sympathetic nerve? The sympathetic nerve, it produces vasoconstrictor effect. Vasoconstrictor effect, and causes the constriction of the vessels, peripheral vessels, and decreasing the lumen of the vessel and increasing the venous return to the heart, maintaining the cardiac output. But in case of the neurogenic shock, when injury to the spine is there is damage to the sympathetic nerve, disconnectivity of the sympathetic nerve supply to the vessel is there, and the vasoconstrictor effect over these vessels has been abolished, and vessels remains dilated. As vessels remain dilated, the more blood will remain into the peripheral circulation, causing decreased venous return to the heart, leads into decreased cardiac output. As this decreased cardiac output, there is a collapse of peripheral circulation. Collapse of peripheral circulation leads into impaired metabolism. Because to maintain the metabolism, the circulation should be normal. But there is a due to decreased cardiac. Why is the decreased cardiac output? This decreased cardiac output due to injury to the sympathetic nerve, which leads into the abolish the vasoconstrictor effect or the constrictor effect on the peripheral vessels, causing decreased venous return to the heart, leading to decreased cardiac output, resulting into collapse of peripheral circulation and subsequently the shock. This is a neurogenic shock. The treatment of the neurogenic shock, it have only the surgical treatment, that by the surgery how to repair the injury and reestablish the sympathetic nerve supply. And as soon as the sympathetic nerve supply will be reestablished, the sympathetic nerve carries the vasoconstrictor effect, or causing the vasoconstrictor of the peripheral vessels. As peripheral vessels gets contract or constrict, their lumen will get decreased and will carry or increase venous return to the heart, and again reestablish or restore the cardiac output. And it will lead to maintenance of the peripheral circulation, and patient will recover from the shock. So these three are the primary shock. Which one? The vasovagal shock, psychogenic shock, and the neurogenic shock. Do you understood? First of all, what do you by the shock? Then classification of the shock and the primary shock. In next lecture, we will see the explanation about the secondary shock. That's all.